So one of NAT's key aims is to increase the public education and awareness around HIV in the UK. We recently commissioned some research with Ipsos Mori into knowledge and attitudes towards HIV, and it revealed some really interesting and sometimes very worrying results. For example, the research revealed that knowledge has declined over the past 10 years about HIV, and belief in myths and misconceptions has increased. 1 in 5 people do not realise that HIV can be passed on through sex without a condom between a man and a woman. And that is a really shocking figure. And in fact, the same proportion of people didn't realise that sex without a condom between 2 men could result in HIV transmission. The amount of people that believed that incorrectly that HIV could be passed on through spitting and kissing has actually doubled in the last 3 years. So these are quite worrying statistics. Positively, the research does show that the majority of the public have supportive attitudes to people living with HIV, but unfortunately there is still a significant minority of people that hold negative attitudes and judgments, and this can have a really negative impact on the lives of people living with HIV. So why is this lack of knowledge a problem, and what do we need to do about it? Well, it's a problem if people don't know the ways that HIV can be passed on, because it means they won't realise if they have put themselves at risk and they won't come forward for testing. And it's also a worry if people incorrectly believe that you can pass on HIV through sharing a glass, because people are going to be scared unnecessarily, and it fuels stigma around HIV and may make people wary about coming into contact with HIV positive people. It's really important for us to break this cycle of ignorance. Interestingly, the Ipsos Mori research did show that there was a link between knowledge of the correct routes of HIV transmission and an understanding attitude towards people living with HIV. And this means that if we could actually educate the public, we think stigma and discrimination towards HIV positive people would decrease. So it's really important. So how can we explain this decline in knowledge? Well, there's many contributing factors, but just an example of some of these are HIV isn't really visible or talked about in today's society. Over the last decade, there's been no real investment in educating the public about HIV. Recent sexual health campaigns aimed at young people have made no mention of HIV, and young people often aren't taught about HIV in schools. Sex and relationships education isn't compulsory, for example, and SRE that does take place is often very patchy. Teachers aren't confident about talking to young people about HIV. The media very rarely write about HIV, and when they do, it's often scaremongering, inaccurate, sensationalist stories. And importantly, because treatment has improved so much, people with HIV are actually living longer and staying healthier, and often don't tell other people that they're HIV positive. So people don't actually know whether their friends or family members are HIV positive, because people often keep it to themselves. So in terms of what needs to be done, we need to improve HIV education in schools, and we need to encourage the media to talk about HIV in a factual way and stop scaring the public. We need to encourage people to talk openly about HIV, and it would be great to see some public figures really taking the lead on this, like Princess Diana did many years ago. There's definitely been a gap. We also need people living with HIV to feel open about talking about their experiences so that we can actually break down the stigma. But while stigma still exists, it's difficult for people to do that. In recent years, we've seen the government make real progress in tackling stigma around mental health, and we'd really like the government to take the lead in tackling HIV stigma.